Reports from the ongoing community-led total sanitation formation activities had indicated that in no distant time, pilot local government areas Ganye and Shelleng in Adamawa State are going to be declared and certified as open defecation-free. The chief, UNICEF Bauchi Field Office, Nushat Rafiq, made the statement when she presided over a field trip to Ganye local government area in Adamawa State for an on-the-spot assessment on the level of implementation. Rafiq explained that the community-led total sanitation was under the third Accelerated Sanitation and Water for All project implemented through UNICEF in collaboration with the Adamawa State government and sponsored by the Netherlands government.
ODF status, and this is the federal government team who comes and in partnership with the state government and UNICEF, they do the whole process of certifying these LGAs as ODF. And I think that is really a successful example from Adamawa, and we look forward that after ASWA3 these two LGAs will be declared as certified as ODF, and then Adamawa state government would take it up as a good practice example and scale it up in rest of the LGAs, because UNICEF and these projects are to demonstrate certain interventions that they can work for community, how they can be implemented, what are the success stories out of them, and what are the results and benefit to the communities. And then these examples should be taken up and scaled up by the state government.
Head of Department, Sanitation, Hygiene and Community Mobilization of the Adamawa State Rural Water Supply and Sanitation Agency, who doubles as the desk officer for the ASWA3 project in Adamawa State, Aisha Yusuf, confirmed the implementation of the project, explaining that after a series of capacity building training for officials and community representatives, the project is currently ongoing in 300 communities across the two pilot local government areas.
So to start with that, we have conducted a series of trainings. As we all know, the background of every implementation is capacity building. So for both local governments, we have trained 44 local government wash unit staff on community-led total sanitation, sanitation marketing, sanitation financing, and climate resilience approach to the CLTS implementation. The CLTS approach is a community-driven approach that tends to trigger community members towards realizing the effects of practicing open defecation with a view to taking an action towards eradicating that practice that is a menace to the people living in our communities.
WASH coordinator in Ganye, Jared Gankuba, posited that for now, they are into WASH confirmation, triggering 150 community-led total sanitation communities in Ganye, appreciating the level of compliance by the communities who are trained and sensitized on how to construct effective and durable toilets against open defecation.
The stage is first after training to increase our capacity in performing the work. We first of all carry out CLTS, that's community-led total sanitation, in which the communities were able to understand the issues concerning sanitation, that's open defecation, and they also find solutions in which they realize themselves that they have to construct toilet in order to separate themselves from open defecation, because they know that it causes diseases. So after that, we are forming committee to take care of those activities in the various communities. For each WASHCOM we formed, we ensure that at least women are up to 40% of the total members of the committee.
St. Francis community leader Sugu Donatus Dona revealed that they have positive outcome from the WASH program in the area, adding that residents of Sugu now wash their hands after every visit to their toilets.
I say the WASH program was good to us in this community. Yeah, we have succeeded. The way that you people brought the program, yeah, we thank God. We thank you people so much. So we have now progressing in that program. So we have noticed, so we have in succeeding. When you go to toilets, you have to have a water, and that water you're going to keep it at the back of your bathroom. After using the toilets, there are soap there. The one that you can use it after using your toilet. So that's why if we do that, if you wash your hand, you clean your hand, you have to come out and work together with people so that you will not, people will not be affected with the disease that you went to the bathroom.
Water, sanitation and hygiene, WASH, is a public health term used to describe a set of basic services and practices that are essential for maintaining human health and dignity. It consists of access to safe and sufficient drinking water for consumption, cooking and personal hygiene, safe disposal of human waste to prevent disease and environmental contamination, and practices like hand washing with soap, menstrual hygiene management, and general cleanliness to reduce the spread of illness and improve health outcomes.